Fibroid is one of the commonest benign tumor in the reproductive age group. Contrary to the common belief, fibroid rarely becomes cancerous. Very rare percentage fibroid can have changes like sarcomatous changes, but usually we take fibroid as a benign tumor. Most problem with the fibroid comes that the patients present with bleeding and heavy periods. Treatment of fibroids actually depend on the size of the fibroid, and fibroid usually doesn't cause infertility. If the fibroid is not of significant size or it's not causing any obstruction to the tubal path, we usually don't have to operate on them for the fertility ground. There are fibroids in different types, like fibroid can be inside the uterus, which is called submucosal fibroid. Some fibroids can be in the muscle part, which is called intramural fibroids, and some fibroids are on the surface of the uterus, which is subserosal fibroid. Of which subserosal fibroids are easy to deal with. They usually do not present with any other symptoms other than growing big. So patients usually present a little bit late with the big fibroid because they didn't cause them any trouble. But small fibroids, if they present in the muscular part or absolutely inside the uterine cavity, they present early with the bleeding problem. Treatment is very simple, especially with the medications. We can keep the period bleeding low. Sometimes we can use some hormonal treatment in the form of tablets and injection to decrease the size of the fibroid. And some moments when the fibroids grow bigger, then we decide upon operating on them, and operations are performed in both ways, in laparoscopically and in open approach. If it's a very huge, big 20-22 centimeter fibroid, it's still we can go for laparoscopy, but obviously that operation takes a little bit more time. But with the fibroid, the main tagline is that we don't have to be very much scared of fibroid because the fibroids are usually benign. Sometimes in perimenopausal age group, if patients present with small fibroid, we do not bother about treating them. We just keep the fibroids and keep an eye on them with the sonography and follow them up. And if patients' periods are stopped, fibroids naturally shrink. So there is a natural treatment for fibroid as well. So we always remember that one of the commonest tumor, and it's always benign. But if you are diagnosed with fibroid, always come to the gynecologist and take the opinion. But it's not always necessary a surgery.